Hello, this is Dicken Kong. I'm here to present to you today our study, which is titled Edoxaban versus warfarin on stroke risk in patients with atrial fibrillation, a territory-wide cohort study. Our study is a territory-wide observational propensity score matched cohort study that took place in Hong Kong. It looks at the development of transient ischemic attack and ischemic stroke in patients with atrial fibrillation treated with Edoxaban or warfarin. The patient data were obtained from the Clinical Data Analysis and Reporting System, CDARS, which is a territory-wide database that centralizes patient information from individual local hospitals in Hong Kong. The mortality data were obtained from the Hong Kong Death Registry, which is a population-based official government registry. The recruitment period of this study was from the 1st of January in 2016 to the end of 2019. The inclusion criteria include atrial fibrillation and either Edoxaban or warfarin prescription. The patients would have been excluded if they had pulmonary embolus and deep vein thrombosis, or if they had warfarin use in the 90 days before the start of their Edoxaban therapy. The observational period ended on the 30th of September 2020. The primary outcome of our study, as we said, was transient ischemic attack and ischemic stroke. Secondary outcome was mortality, and safety outcomes include ischemic heart disease, hemorrhagic stroke, and gastrointestinal bleeding. However, in this presentation, we'll mainly consider the primary outcome. Propensity score matching were performed, matching for demographics, comorbidities, and medication use in order to generate a control group for the Edoxaban cohort. Univariate Cox regression was used to identify significant risk predictors of the primary, secondary, and safety outcomes. Hazard ratios and corresponding 95% confidence interval and p-values were reported. Over the recruitment period, we identified 6,957 patients who had been prescribed Edoxaban or warfarin. However, after exclusion criteria were applied, only 3,464 patients were in the included cohort. After propensity score matching with a 1:2 ratio, we had 664 patients with Edoxaban use and 1,328 with warfarin use. The incidence rate of transient ischemic attack or ischemic stroke was 1.51% in the Edoxaban group and 3.61% in the warfarin group. As we saw in the previous slide, the development of transient ischemic attack or ischemic stroke was more common in the warfarin group when compared to the Edoxaban group. Indeed, the use of Edoxaban was identified in univariate Cox regression analysis as a protective factor with a hazard ratio of 0.1. Several other protective factors were also identified, including male gender, baseline ischemic heart disease, prescription of calcium channel blockers, and a higher albumin level. Prior intracranial hemorrhage was identified as a risk factor with a hazard ratio of 4.37. The key finding of our study was that when compared to warfarin, Edoxaban use was associated with a lower risk of transient ischemic attack and ischemic stroke. In clinical trial, however, high-dose Edoxaban and warfarin were found to carry a non-different risk of ischemic stroke. There's this discrepancy here that we'd like to try to address. One of the reasons that could account for this is racial differences. However, we believe that the more important reason is that in clinical trials, warfarin users are typically very well managed in terms of their international normalized ratio. In reality, however, Asians especially are not likely to achieve optimal international normalized ratio control because of bleeding risk. The finding of our study is consistent with other observational studies performed in Asia